Hello everyone, welcome to CAPSA. Today's topic is nitrate. So what are nitrates or organic nitrates? These are the polyol esters of nitric acid which act as a prodrug to release nitric oxide or NO and causes vasodilation, also known as vasodilators. Okay, coming to the mechanism of action. After the enzymatic bioactivation of organic nitrates, it releases nitric oxide, which activates the guanylyl cyclase enzyme. This enzyme synthesizes cyclic GMP or guanosine monophosphate from GTP or guanosine triphosphate and increases intracellular cyclic GMP level, which promotes dephosphorylation of myosin light chain kinase and decreased cytosolic calcium 2+. As a result, relaxation of smooth muscle cells in a broad range of tissues. What are the classifications? Based on the duration of action, it is of two types: short-acting glyceryl trinitrate or GTN, nitroglycerin, isosorbide dinitrate when used sublingually, long-acting isosorbide dinitrate when used orally, and isosorbide mononitrate. So, what are the pharmacokinetic parameters of these drugs? Glyceryl trinitrate, or also known as GTN or nitroglycerin, absorbed sublingually through the mucous membrane. Okay. It is distributed widely in the body with a apparent volume of distribution 200 liter in adult. All of you know what do you mean by apparent volume of distribution or VD? It means amount of drug in body divided by plasma drug concentration. Okay. It is metabolized in the liver via denitration process to form metabolite 1,2-dinitrate excreted by kidney. Coming to the next drug, isosorbide dinitrate, absorption occurs sublingually and orally. Sublingually through the mucous membrane, and orally through the GI tract or gastrointestinal tract. Distributed in the body with the apparent volume of distribution 2 to 4 liter per kg. Metabolism occurs in the liver via conjugation process to form conjugates like isosorbide 2-mononitrate and isosorbide mononitrate. These are the initial metabolites. Both of these shows longer half-life. Okay, longer half-life. Excretion occurs through kidney and feces. Coming to the next drug, isosorbide mononitrate, which absorption occurs through the oral route. Distribution, volume of distribution 0.6 liter per kg. We should keep in mind protein bound of this drug is very less than 5%. Okay. Metabolism occurs in the liver via conjugation process. Excreted through urine and feces. Okay. Now, what are the tolerance and unwanted effect of nitrates? If we use prolonged for high doses, it can cause tolerance, which totally depends on the dosage and frequency of uses. Unwanted effects are orthostatic hypotension, throbbing headache, and tachycardia. Orthostatic hypotension is due to direct extension of vasodilation effect. Throbbing headache due to meningeal vasodilation. Here vein is involved, but here artery is involved. Okay? Tachycardia means increased heart rate, which is due to baroreceptor reflexes. Okay, baroreceptor reflexes. What are the drug interactions? Nitrates interacted with phosphodiesterase 5 inhibitors like sildenafil, which are used for erectile dysfunction. Phosphodiesterase 5 inhibitors is also known as PDE5 inhibitors. Okay. Erectile dysfunction is the problem of penile organ of male. Okay. In the erectile dysfunction, actually blood flow decreases. So we need to do what? We need to increase the blood flow. To increase the blood flow, obviously we need to do vasodilation or relaxation of smooth muscles. To do vasodilation or relaxation of smooth muscle must be increase in the cyclic GMP. If the cyclic GMP level increases, then vasodilation or relaxation of smooth muscles happen. So for PDE5 inhibitors or phosphodiesterase 5 inhibitors causes the decreased breakdown of cyclic GMP level. As a result, increasing the cyclic GMP level, nitrates also increases the cyclic GMP production. What happens then? Obviously, both of these drugs shows synergistic effect. As a result, hypotension, inadequate perfusion, of higher organs. Now, what are the therapeutic uses? For the treatment of angina pectoris, both stable and unstable to terminate the angina attack. For the treatment of myocardial infarction or MI to relieve chest pain by altering oxygen balance in the ischemic area. And pulmonary congestion via bronchodilation. And for the use of acute heart failure as a temporary treatment for partial relief of symptoms of motility disorders such as achalasia. Okay. Thank you for watching.